Hi, my name is Janet, and I just recently went to a seminar where we live on dementia and Alzheimer's. And I thought I'd share some of the tips that I learned because I thought they were so phenomenal. My husband's father is suffering with dementia, and so we went to this class to learn more about it. One of the things that we learned that we really didn't know, we know that the brain shrinks as they go through dementia, Alzheimer's, but there are like 102 kinds of dementia, and that's the umbrella of dementia, but underneath that falls Alzheimer's. So there could be many reasons why your loved one has dementia. But one thing that we learned was as the brain shrinks, so does the vision. We couldn't understand why his father couldn't see the clock and tell time. Well, what she told us was, you have this much vision, and you also don't have depth perception. So if you notice sometimes if they walk between the carpet and tile, they can't tell, where the floor is or if the floor is close to them, and so you'll see them scoot. One of the other things we know is that they lose their dexterity. They might start eating with their fingers, they can't hold a fork. These are signs that they're telling you that they have dementia. So when you're diagnosed with dementia, you may even be 2 years into it before someone really recognizes some of the signs that they have. But, her point was there's no cure for Alzheimer's. They keep saying there's things down the road, but that's not going to help you now. There really is no cure. There's no reversing. This lady, Debbie, was the head of a memory care unit. Her husband had Alzheimer's, dementia. And she said, I wasn't a very good caregiver because I didn't know that the things that I know now. So she stepped down from being this administrator at a memory care because she thought she would be better used to go out into the community and help people learn how to take care of a loved one with dementia because nobody really teaches you that. One of the things that she taught us was that, yes, there are fall risk, but there's this hand movement that you can use. So you take your hand and you take the other person's hand, and if they're right-handed, you take their right hand. If they're left-handed, you use the left hand. You go like this, and it's called an underhand, and you go like this. So your hands are free, his or her hands are free, and you can take them and guide them just about anywhere. You can move into their space, put your arm on their shoulder, and when you do that, they're pretty much going to stand up because they knows what that means. But you've got them, and they can't hit you if they're being combative. But her point is, they won't be combative if you are compassionate and loving towards them. She gave an example. So I'm sitting here, my loved one or a nurse or somebody comes up behind me and touches me on the shoulders. Okay, when you have dementia, your hearing is different. So someone could be talking to you in the background over here, and you don't even know that because you have dementia. Your world is just here and here. So when someone comes around and they said, I told you to get your coat on, we're getting ready to go. They didn't know that they were talking to you, and you may not realize that. But anyhow, if someone comes up to you and they put their hand behind you and you're going to just go like this, and guess what? The nurse is going to put on the chart that you're combative, and they're going to give you Ativan or something to calm you down. You're not really combative. It's just that you invaded their personal space. They didn't know, they're not aware that you're behind them, and you scare them. So her point is that you go around and you always keep an arm's length of space, just even with a regular person that doesn't have dementia. You've heard you keep your personal space. So an arm's length. But if you use that hand movement and go like this, you can go in, you've got control of their hands. But the other thing is you could take that hand and go up like this and help them to wash their hair. You can help them brush their teeth, and then they may even just continue on their own. So using that is very, very helpful, and if they are combative, it keeps them from hitting you. So when you shake somebody's hand, they can get loose and they can hit you. But her point is if you're loving, they're not going to hit you. So what she used to do in the nursing home, she would go up and say, you're talking to Joe. Instead of, yelling at Joe, come on, Joe, you have to go to breakfast. Come on, you're late. If you just go in and open your arms up and say, hi, Joe, how are you? If you speak slow and clearly, that makes them calm. Because she said the one thing that Alzheimer and dementia patients have is feeling. They never lose that feeling. So when you make them feel loved and valued, they will respond better to you. So it may take 2 or 3 days for someone, especially like in a nursing home, before they can trust you, but you just keep, hello, how are you? The other thing is, she said, was pressing them to go to the bathroom. You know, just like a 2-year-old. Their response is, no, no, no. So you can't talk loud to them because the loudness hurts their ears sometimes. And if you're calm and you just go, you know, if you use this hand effect and you lean into them and you go up behind them and put your hand on their back, and maybe you say, you know, Joe, there's somebody down the hall that I think you would really enjoy meeting. And you go in and you put your hand behind them. That's a natural response for them, and they will stand up. And what do? You walk them down the hall and you walk them to the bathroom. They see the bathroom and they'll sit down. But by you hounding them and yelling at them and saying, I'm not going nowhere until you go to the bathroom, they're like a 2-year-old. They are going to respond bad. The other thing is, if you should never argue with them. The guy gave an example. He had a brother, so his mother had 2 sons. Okay, well, she didn't recognize him, and she thought one of them was her brother because she had 2 brothers. And he argued, Mom, don't you know I'm your son, blah, blah, blah. Well, she got very angry, and that just kind of ruined the mood for the whole day. She was not receptive to talking to him. So he and his brother talked about it. You know, the next time that he went, he and his brother, she called him by her brother's names, not her son's, but they had a pleasant conversation. They learned things about their mother growing up that they didn't know. I mean, she just was happy. So, you know, just go with the flow. It may be hurtful to you, and it probably will be. But, you know, that person is the one that needs the caring. They didn't ask for this disease. They didn't know they were in this disease. So, you know, whatever you can do to make their life pleasant, because those feelings inside is how they respond. They say people can even go off medication and not be combative when you treat them with love and compassion. It was just really an amazing story that she told us. was her husband. They put him in 4 or 5 memory care places. Immediately, she says, I mean, within hours, he was thrown out. And then they put him like in a mental hospital where he was physically and mentally abused. So this lady, she had to find another place, and this lady said, I'll take him in the one place. And she thought, well, what have I got to lose? I mean, he's been thrown out. This is the lady that taught her how you treat them with love and compassion. And she never had a problem with him since. She didn't argue with him. You know, she learned the ways to how to approach him. The other thing is, you know, the left side of the brain goes, well, the right side can be uncontrollable. That's where the bad words come from, the cussing, the truthfulness. I mean, she was kind of a large lady in this class, and she said she bent over to pick up something, and this lady said, you know, you've got the biggest fat, with an A, that I've ever seen in my life. Now, this lady would have never said that to somebody if she didn't have dementia or Alzheimer's. But you know what? Instead of getting angry, Debbie turned around and she just said, thank you. I'll work on that, see if I can, you know, do that. So if this is helpful to you, I hope it is. I may have some more tips I think about later, and if so, I'll go online and post them to you again. So have a blessed day. You know, it's a hard disease, but the Lord will get you through it.